When I think of Middlesex Health, I think of them as my family, and that's every single person in this organization.
It doesn't have the typical hospital feel here. Just everyone gets along really well and is really kind.
And it's a very respectful, very collaborative culture.
I get to spend a lot of time with my patients. I get to be thorough. I get to learn. I get to be efficient. I leave here feeling pretty good about what I've done.
To go to work every day and know that, you mean something in some way and you're not just a number like other institutes, it means a lot.
I know my work is appreciated through Middlesex and the team that I specifically work with, because we're told often.
Everyone just comes together, even if you're just having a rough day and you're like, hey, I really need a little bit of support. You'll have like 3 different people coming at you being like, how can I help? What can I do?
If I'm drowning and I'm overwhelmed, somebody will notice and they will come up and say, what can I do for you? And they mean it.
Compared to other places that I've worked, it's a lot different. I feel like our voices are heard.
The voice of nursing at Middlesex is, I'd say, loud.
You have the ability to voice whatever it is you're thinking, whatever your opinion is.
Being able to communicate with not just your peers in your department, but being able to cross those lines and talk to administration. Our CEO came down along with the CNO, and they came down to our department and spent over an hour talking to us, answering our questions, wanting to know our feedback and our input. I don't know that there are a lot of places that would do that.
With larger hospitals that I've worked at in the past, we kind of feel lost in the crowd, lacking support because there are just so many people coming and going all the time. Whereas here, there were some of the nurses that I worked with in orthopedics that have been nurses for like 30, 40 years.
So magnet to me in a nurse care concept means I'm part of the decision-making process. I'm part of what is going on in the hospital.
Magnet is the foundation of who we are at Middlesex Health. It is not an award. It truly gives us a pathway and allows us to promote professional development.
Middlesex is a learning environment and definitely puts emphasis on continued education here.
There are lots of opportunity to grow.
When I came here, I was an associate's degree nurse, and my manager helped me get through programs and give me time to study and worked with me so that I could earn my bachelor's.
Reimbursed for nursing and for masters that aren't nursing related. So they knew that would help me maybe down the line in my nursing career.
They want us to succeed. So in order for us to succeed, they allow us to be part of processes here.
When there's an issue, Middlesex asks their staff members, their nurses, their disciplines, what can we do better? And how can you be involved in making improvement? And that alone says a lot about the Institute. It's not just about leadership deciding what's best. It's about the nurses, the people on the floor that help to make those decisions of improvement.
If you're persistent and you can show reasons why you think it would be better, reasons why it's improving, your evidence-based practices, they listen and they will make changes.
We utilize evidence-based practice in order to ensure that we make the best decisions, not only to elevate what our nurses are able to speak to from a clinical practice. They are placed in the driver's seat and invited to the table in order to make decisions about their everyday practice.
And there's something about going and having that conversation with staff and seeing oh wait, you want my thoughts on this? And it's, yes, I do, because you know what the solutions are. You're gonna be the ones who fix the challenges. I just have to get to you to find out what your thoughts are.
I feel like I have a voice here. I feel like I have a direct influence on the plan of care, rounds every day. I know that the providers are listening to what I have to say.
I feel like what I do is valued and recognized.
I have been told thank you or been recognized for my achievements multiple times, like even weekly.
And it's a very respectful, very collaborative culture.
I don't know if it was magnet first or the culture first, but whatever it is, it's melded together into something amazing for how it works. And I guess my answer at this point is, does it matter what came first? It's here.
It feels like you're just part of a big family people know each other, they're friendly, they're caring.
And we do our best to provide good care for people. They're not patients, they're people.
People don't go into nursing because they're like, oh, I just need my check signed at the end of the month. Like, no one goes into floor staff nursing for that. We go in because we want to help people. We want to make them feel better, feel safe in their care.
Being a nurse at Middlesex is an incredible experience. I come to work every day. I know that I can be a good nurse for my patients, be an advocate. I just feel very supported, which allows me to, make a difference in my patients' lives.
We know that we're valued. Everyone makes it known that we're valued. It's a really great team environment.